Okay, friends in the back, are we good? Can you hear me? All right, where's the, here. Now, have I learned anything from watching everyone? Oh! Okay, cool. So, I'm just troubled with this question. How can we as a naturopathic community contribute to this country's current dire need for a healthcare overhaul? I mean, I absolutely loved listening to everybody before, the presentations before. And if we can, just give everyone a round of applause, please. I feel like we need to infiltrate the system. I don't know, I'm a rebel. So I don't like to stand on the sidelines, and I feel like our job is to be inside the problem. So maybe you can help me figure out what that looks like. Greetings, my name is Virginia Caldwell. I'm a third-year student at night, and I currently work in the field of traumatic brain injury rehabilitation as a music therapist. So part of the problem with going to night is like you now have naturopathic glasses on, and you see the need for naturopathy everywhere you go. Oh, you need naturopathy. You need naturopathy. So I took this job, and all I can see is the need for naturopathy. What is naturopathy? Well, it's clearly an art. You all have this phenomenal car, I don't know, this beautiful body that your soul chose to drive on this planet. And it is so intelligent. So finding a balance in it is an art form. It's a science. We've looked at countless studies today. Methylation, isn't that phenomenal? Who knew all of that was happening? You didn't even think about that. And those things are happening in your cells right now. Philosophy, it's a way of life for our family as well. Naturopathy uses non-invasive forms of evaluation in this beautiful car that you have. It's a complete dashboard. What are your nails saying? What are your eyes saying? Iridology. What is my skin saying? Everything is telling you how your body is doing in this moment. It employs the forces of nature and natural tools. We just learned about the importance of sun and water. Naturopathy follows the Hippocratic Oath because Hippocrates was a naturopath. Y'all put that together? Man, they didn't have medication back then. Hippocrates was a naturopath. So it is the original medicine where we do no harm, we use the healing powers of nature, we address the root cause, we heal the whole person with individualized care, and we teach so that you know how to take care of your expensive, amazing technology that you're driving. Most technological link here. Who needs a cell phone? All right, so let's put a pin in naturopathy and let's talk about brain injury. What is brain injury? A traumatic brain injury is an injury to the brain caused by an external force such as a blow to the head, an object piercing the skull. TBIs range from mild to severe. Brain injury causes. I won't read the list, but the brain injuries that I see mostly are car accidents. So what does that look like? Trauma to the brain. Blunt force trauma is this first picture, your left, and it is in one spot. That's a focal brain injury. It's a focused area of injury. The middle picture is what happens in a car. You're driving. Everybody put your cars out, steering wheel's out. And you stop suddenly, you go forward, and then you come back. So now we have a diffuse injury. We have an injury that is in many regions of the brain. If you see the little red dots, you can also see where the injury happened at the brainstem. And then a blast injury for our men and women that go to war and have to risk their lives for us. So what happens in the brain? We have damaged nerve cells, we've got systemic inflammation, we've got chemical imbalances because the brain is now not signaling properly, we have cell-to-cell deficiencies in signaling, we have a secondary injury because once the tissue is damaged, we have problems in the area surrounding the tissue damage. That manifests in a physical, mental, emotional, personality, like cycles, sleep cycles, everything is going wrong because the signaling in the command center is down. Our current outcomes, I'm going to be really honest with you, that is way brighter than what I see at work every day. This says 57% of people who survive with TBI, mild to severe, are disabled 5 years after the injury. 57. I'm going to be honest, it's like 90 for me. 55% go back to gainful employment. Social relationships are destroyed, and people lean towards substance use to to feel normal, to quiet the pain, to quiet the noise in their mind. So, what does the current team look like? We have your PT/OT speech, sometimes rec and music, kind of depends on where you go, RN, medical doctor, PM&R, and they're looking at this body, that beautiful body that you're driving, that technology as a machine, and we're going to use medications, and then we're going to use repetition. And I mean, it's what we're trained, it's what they're trained to do, so it's not their fault. But our bodies are so much more. So I can't tell you every problem that I have, but I'm just going to focus on one today. We can chat over coffee for the other ones if you like. But let's just go down the medication train. So we have our SSRIs, which are selective serotonin reuptake inhibitors, and they're used to manage depression and anxiety. You have your methylphenidates that stimulate cognition. You have your amantadines, which improves cognitive function, manages behavior. You have antipsychotics for psychosis, agitation, severe mood swings. We got more, guys. We got painkillers that we're going to use, other opioids or NSAIDs, anticonvulsants so that we can manage seizures, mood stabilization. We got muscle relaxants to use to manage muscle spasticity. Cholinesterase inhibitors to help with memory problems, beta blockers so we can manage anxiety outbursts, anger outbursts, and sometimes headaches. Whew. Okay, so some of those names might be familiar because you have, or all of them. Can we talk about side effects? Because if we take, and I'm going to tell you what, the people that I see, they're on mostly all of them. So if that's the case, then we're having these side effects like GI issues, sleep disturbances, anxiety, dizziness, weight gain. Okay, well, if we're not on a medication for that, guess what? We're going to need to be on a medication for that because that's the way our system works right now. Stimulants, anticonvulsants, we have a loss of appetite, insomnia, weight loss. Insomnia, going to have to give you Restoril or something for sleep. You guys have seen the commercials. Anticonvulsants, blurred vision, problems with the liver and pancreas. Okay, well, if we got pancreas problems, maybe we're going to have diabetes. Oh, look, diabetes, antipsychotics. So what? We're going to have to put you on Ozempic, right? Oh, yeah. So what does this all mean? Oh, I'm sorry, another page. All right, seizure meds, weight gain or weight loss, definitely Ozempic. Tremors, drowsiness, agitation, GI issues again. We have so much gut dysfunction. Vision problems, painkillers, the opioids to suppress respiration, the NSAIDs, damage the kidneys. What? We were trying to heal the brain. How did we get here? Okay, so this is called polypharmacy. If you take more than 5 medications a week, prescription or not, it's called polypharmacy. These stats are for someone who hasn't even had a brain injury. 44% of men 65 and up, 57% of women 65 and up. 12% take more than 10 a week, which I think is, again, generous. The risks associated with polypharmacy are adverse drug effects, drug interactions, drug disease interactions, and unplanned hospital admissions, like also leading to death. I thought this was interesting, and so I had to put it in my talk. This is from Frontiers in Neurology, and it says, despite decades of rigorous preclinical research in which greater understandings into the diverse nature of brain injury has been gained, effective therapeutics for TBI-induced disease of neural network and behavioral cognitive impairments are lacking. Okay, good to know. Good to know that all of these things aren't working. They're not working. They make people a lot of money though. So I'm going to say, enter naturopathy. We're going to address the root cause. We're going to treat the whole person. We're going to do no harm. Did any of those medications talk about the brain injury? Just the outcomes and the symptoms that we need to manage. They don't see the body as a dynamic whole. They don't see supporting all systems, and their intricate connection is the way we're going to get to a better place. So I have a few snippets of some journal articles that I thought that just really spoke to me, and I'd like to read them to you. The brain-gut axis, which we talked about a little bit more with Allie. Go, Allie. Is comprised of a bidirectional pathway. I want you to think 127, north-south, through which TBI-induced neural inflammation and neurodegeneration impact gut function. Furthermore, resulting TBI-induced dysautonomia and systemic inflammation contribute to a secondary GI event, including dysmotility, we're stopping the movement, and increased mucosal permeability, that is leaky gut. So we have an injury in our brain and a secondary injury in our gut. Those medications, what do? Damage the gut too. Recent research on the gut has shown that gut microbial dysbiosis after traumatic brain injury modulates the immune response and impairs new neural formation. Oh my gosh. If we don't create new neural pathways, connections, how do we get better? We keep doing the PTOT speech, but we don't make the improvements because we can't make new neural pathways. Chronic TBI induces changes in the colon bacteria and fungal colonies, affects the mucosal barrier, but what it's doing is it's reducing the expression of Claudin 1, which is a key component of the tight junctions. Tight junctions are what keep your brush border together. This parallels the known increase in neural inflammation and degeneration in the injured cortex. The importance of the gut-brain communication in maintaining homeostasis highlights it as a viable therapeutic target for TBI. Wow. Wow. This goes on to talk about lactobacillus, different lactose. This goes on to talk about lactose and bifidose and other butyrate-producing gut bacteria that are most beneficial. And they help with the inflammation. They help with the cellular lining and intracellular communication and the immune response. This is bananas because the lactose and the bifidose are the ones that are most harmed by the medication we talked about. So not only do you have a brain injury, but you have additional injury to the gut with every one of those doses of medication. So as a naturopath, we talked about gut health. Allie gave us great resources to utilize to help to repopulate the gut, to help to mitigate damage. We're going to use food. The toxic stress cycle tells us that we start in the digestive system and the colon anyway. So why wouldn't we start there? Food is therapy. Without those gut microbes, we can't make the minerals or the vitamins. We're also going to use things like craniosacral, myofascial. Imagine you're traveling at 70 miles an hour and you come to a sudden stop. Where does that energy go, my friends? Into your body. And it's locked up and it's tight. Oh, I wish we had that fascia conversation. Oh, would be great. All right, so we're also going to use homeopathy, essential oils, and herbs. We have so many tools that don't require a dictionary to understand how to pronounce them. Non-invasive technology and resources. So I love Dr. Eric Braverman's work. Great information on neurotransmitters and amino acids, the BioWell, the energetics, the Vexia Labs, various gut panels you can do. You can see what is depleted, and we can look at brain chemistry testing. These are all your neurotransmitters. What's low? What's high? Let's not throw darts at a dartboard. Let's get in there and find out. So who would you have on your team? Who would you have on your loved one's team?
Naturopathy.
Thank you. Let's try again. Who would you have on your team? All right, so closing thoughts. I got 18 seconds. Forgive me if I go over just a second. So very societal need for a quick fix. Guys, we can't fix it overnight. So it's gonna take some time. Natural health reframed. We get a bad rap. Right? We're woo-woo, we're crazy, we don't know science, follow the science, all that. Funding. It's hard to pay for quality naturopathy it's not hard to, when you prioritize, but when you can get your prescription for $4, but that evaluation, that hour and a half naturopathic evaluation costs double digits versus your $4 prescription, you tend to go for the $4 prescription because we don't know. Hope for the future. People are sick and tired of being sick and tired, and people are seeking natural health measures. So my hope is that partnerships between naturopathy and Western medicine will happen for the greater good of humanity moving forward. So, you just give me 30 seconds. Actually, 10 seconds, I have a poem. So I rewrote the beginning parts of I Have a Dream. So I have a dream that one day this healthcare system will rise up and live out the true meaning of the Hippocratic Oath. I have a dream that the cafeterias of medical schools far and wide will have young, bright, traditional naturopathic doctors and dedicated young medical doctors, and we'll be able to sit down at the table together and discuss cases and root causes. I have a dream that one day even the state of Florida, South Carolina, and Tennessee, states that swelter with the heat of oppression for naturopathy, will be replaced with recognition, acceptance, appreciation for its tremendous impact in health. I have a dream that my free children will live in a nation that's not seeking to keep them sick for monetary gain, but will nurture them and the planet through holistic healing practices for their well-being for many generations to come. I have a dream today, should anyone I love need neural care, there will be a naturopathic doctor to help support the team to make informed decisions and seek true restoration. Thank you so much for your time.